Your Excellencies, distinguished ladies and gentlemen, gentlemen of the press, good evening. It is my singular honor and privilege to welcome you to this very timely and crucial dialogue. Thank you very much, everyone, for coming all the way to grace this occasion. Before we get into the heart of our conversation this evening, may we please stand for the national anthem. Thank you, ladies and gentlemen. Please may be seated. Sorry? Oh, I got it. Okay. Your Excellencies, ladies and gentlemen, please may I invite to the discussion His Excellency the Governor of Kwara State, Abdurrahman Abdul Razak. You're welcome, sir. Please a round of applause for him. May I also invite His Excellency the Governor of Zamfara State. Okay, great. We have in our midst His Excellency the Governor of okay. We have in our midst the Governor of Zamfara State, His Excellency Dauda Lawal. You're welcome, sir. Please let's celebrate them. We also have in our midst His Excellency the Governor of Niger State, Mohammed Umar Bago. His Excellency, you're welcome, sir. We have in our midst as well the Honorable Minister of Health, Professor Mohammed Ali Pate. You're welcome, sir. Okay, the Permanent Secretary is here to represent the Minister of Agriculture. Is here to represent the Minister. Please come to the podium. Okay, I've been notified that the Governor of Kebbi State is sending a representative in the person of the Deputy Governor of Kebbi State, and he is very much on the way. He will join us shortly. Let me also welcome the MSF Country Director, Dr. Simba Tirima. You're welcome. Let's appreciate him. Your Excellencies, ladies and gentlemen, we also have in our midst the Chancellor of Athena Foundation for Policy and Leadership, Chief Osita Chidoka. Please let me celebrate him. May I, at this point, invite Chief Osita for the welcome address. Chief Osita, sir.
Thank you very much. Good evening, ladies and gentlemen. Your Excellency, the Governor of Niger State, Your Excellency, the Governor of Zamfara State, Honorable Minister of Health, representative of the Minister of Agriculture, Director of Nutrition, Dr. Simba, a friend from Medicine Sans Frontier, the MSF. You're all welcome to this evening, and this is an evening to bring to public consciousness a rising problem in our country, the problem of the malnutrition that MSF kind of tripped up everybody in Nigeria with the report about the increasing wave of people in their hospitals, in their clinics, rising over 200%, and the danger that the FAO highlighted in 2023 that almost about 26.5 million Nigerians will suffer from acute hunger in 2024. In that same 2023, CADA reported that about 35 million children under the age of 5, with 12 million likely to be stunted, and about 23.5 million anemic, and 17.7 million hungry people in our country. Now, for us in the Athena Centre, we have decided that the time has passed to glorify problems, but to proffer solutions. We believe that numbers are very important when we hear 17 million, 20 million. These are numbers, and they do not represent people in the consciousness of many people. When I was at the Federal Road Safety Corps, I used to ask a question, by how many percent should we reduce road fatalities in the world? And people always responded 50%, some say 70%, some say 30% annually. And then I turn back and ask, by how many percent should we reduce fatality in your family? And everybody says 0. Nobody wants anybody in his family to die from road crash. So it has turned out that whenever we speak in numbers, we always put percentages, but these are people, these are Nigerians, these are our children, these are our brothers and sisters. And I think it is important this evening to bring it to national consciousness and to also find out what are we doing about it? What is the federal government doing? What the state government doing? What are the international partners doing? And how can we all help in bringing this together, finding out what the challenges are, that despite the warnings we've had in the past, we still are confronted with these issues, and how in the long term we're going to resolve these issues to make sure that Nigerians do not have to go to bed every day hungry. Thank you very much and welcome.
Please, another round of applause for Chief Osita. Ladies and gentlemen, in our country, we have many armchair critics. We have people who talk more and do less. But here in our midst, we have someone who is not just talking, but is doing. Please let me celebrate him once again. Well done, sir. We will be calling the next speaker. That is in the person of the country director of Medecins Sans Frontières, MSF, and that is Dr. Simba Tirima. You're welcome, sir.
Your Excellencies, the governors present here with us, honorable ministers, distinguished guests, and my fellow panelists, some of whom are not here but will join us later. In the recent years, the world has witnessed alarming trends in global food insecurity. These trends are characterized by a significant rise in the number of people experiencing high levels of acute food insecurity due to conflict, climate change, economic shocks, and other factors. Nigeria, particularly its northern states, is among the regions severely affected by these global trends. I'm honored to present a very brief update on the current state of malnutrition in Nigeria, specifically focusing on the clinical MSF data that we have gathered from our work in 7 states, namely Bauchi, Borno, Kano, Katsina, Kebbi, Sokoto, and Zamfara. Medicine Sans Frontier has been directly implementing its malnutrition programs in collaboration with the respective state governments and the Federal Ministry of Health and Social Welfare. Our first-hand data underscores the critical need for sustained and coordinated efforts to address this urgent and pressing issue. However, I'm fully aware that the esteemed Minister of Health and Social Welfare, the Minister of Agriculture and Food Security, the esteemed governors present here today have a comprehensive and overarching view of the situation across Nigeria. Therefore, I offer this update, very brief, albeit in a spirit of collaboration and humility, recognizing the valuable insights and broader perspective that our distinguished panel members bring to this critical discussion. Let me zoom out for just a second. Nigeria is not the only country that is going through this crisis, but we are here. And as our very able convener said, it is the Nigerian children that are going to bed hungry. It is the Nigerian children that are on the brink of death because of malnutrition. But globally, the prevalence of high acute food insecurity has doubled from 11% in 2016 to 21% in 2023 across 59 countries and territories around the world. Nearly 24 million more people face high levels of acute food insecurity in 2023 as compared to 2022, reaching a total of 281 million people. This marks the 5th consecutive year of rising numbers. Conflict remains a primary driver of acute food insecurity around the world, affecting 135 million people in 20 countries. In many cases, conflicts have deliberately targeted food production and distribution systems, using starvation as a weapon of war. Economic shocks, including rising costs of living and national debt, have also significantly contributed to food insecurity. Countries heavily reliant on food imports have seen dramatic increase in food prices, limiting access to many households. Of course, the impact of climate change, we saw the floods about 2 years ago, are being felt. Erratic rainfall patterns in the north and throughout Nigeria are a factor that we live with today. In 2023, weather extremes were the main driver of acute food insecurity for over 72 million people in 18 countries. The effects of climate change are particularly severe in agricultural regions. I consider myself from Zamfara. Farming is our pride. The pandemic, of course, disrupted the supply chains, and we're still recovering from that. But I'd like to think as a summary of these 3 C's: conflict, climate, and cash being some of the major drivers of what we see. The current situation in Nigeria is dire. In a recent report that was cited earlier, we have heard the numbers, and I'm not going to repeat those numbers, from the Federal Ministry of Agriculture through the Cadre Harmoniesi. The program and administrative data from the Ministry of Health and Social Welfare show an increasing trend in number of children with severe acute malnutrition. Approximately 2 million, listen, 2 million children in Nigeria suffer from severe acute malnutrition, while another 6 million are moderately malnourished. Unfortunately, a very small percentage of these children are currently receiving necessary care and treatment. Those that are moderately malnourished, if they don't get attention, will become severely acutely malnourished. Those that are severely acutely malnourished will die if they don't get any attention. You can imagine 2 million children dying. Children with severe acute malnutrition are 9 to 12 times more likely to die compared to healthy children. Ladies and gentlemen, we're talking about an urgent situation here. I can speak about our MSF data. This is very clinical data. This is what we see from day to day. We're not talkers without borders. We're doers without borders as well, right? Working very closely with the states, working very closely with the federal government as well, because we're guests of the government, helping to put out this fire. But our work is merely a drop in the bucket. Currently, we have more than 900 beds across the northern states, and most of them are fully occupied. And some children have to share beds as well. Others have to be on the floor, because that's the way it is. We have several outpatient facilities as well. Other actors are doing so. But again, this is a drop in the bucket. Together, I believe we can do something to put out this current fire. We can't be talking about development years down the line. We can't be talking about stabilizing the economy in a few months while the children of Nigeria are dying. A child who died of malnutrition yesterday is a tragedy. A child who dies of malnutrition tomorrow is preventable. Thank you.
Thank you so much, Dr. Simba Tirima. Indeed, a child who dies of malnutrition tomorrow is preventable, and we must do all we can today to prevent a tragedy in that direction. Thank you very much, sir. A round of applause for him once again, please. May I at this point invite Dr. Ridgar Tili-Giado from World Bank. The IT, are we good? He is presenting online. I just want to be sure that we are good with having him at this point. He is going to be talking about the World Bank's intervention and sharing insight for us to understand what the World Bank is doing. The IT, please. Okay, my apologies. We are getting ready to welcome the World Bank's representative in a minute, but then we will move on to the next speaker. And may I invite the Honorable Coordinating Minister of Health and Social Welfare, Mohammed Ali Pate, CON. Please let me celebrate and appreciate him as he comes. You're welcome, sir.
Thank you. Your Excellencies, the Executive Governors of Niger State, Executive Governor of Zamfara State, the co-host, my friend and brother, Dr. Osita Tidoka, my sister who is representing my older brother, the Minister of Agriculture and Food Security, and my other brother, Dr. Simba of MSF, distinguished ladies and gentlemen. First of all, it's a great honor to co-host this with the Athena Centre and to also be joined by our executive governors and their representatives, at least for the governor of Kebbi State, in this important event. That signifies the unity of purpose and the priority that we all put behind this idea that every life counts and our children are among the most important assets that this country has. I know that it's a very difficult issue that we are discussing, which is severe acute malnutrition, but I would like to frame it in the context of an optimistic future that we have, which is what our president has laid out as part of his renewed hope agenda, that Nigeria can be a great country and that there is prosperity in its future. But the reality is that over the last several decades, we've not optimized in harnessing the potential of that people that we have been bestowed upon. And poverty increasingly over the last 10 years has sort of been increasingly concentrated in our country. And we're seeing the manifestation of that, which didn't start in the last 1 year, and it didn't start in the last 2 years, 3 years, but it's a systemic issue that has been going on for some time. And to understand what we're seeing as a symptom, this is not the disease. The acute malnutrition is a symptom. The underlying issue is our population dynamics. I think we've got a structure of population that is fast growing, but is also high dependency. For every one working age adult, we have several dependents behind them. We've also got high mortalities of children in the backdrop, just as a long-going trend. High fertility rates in some parts of our country more than others, but across the country, and gaps in things like reproductive health services. This is not disconnected with what we are seeing. The issue we're dealing with of malnutrition has been ongoing in our country and across all geopolitical zones of this country. Issue of stunting is there, 38%. And that's what we're trying to resolve, not to lament, but to resolve. The treatment of common ailments contribute to the malnutrition that we see, and that's why we're investing in primary health care to expand that so that our children survive. Water and sanitation contributes because a child who is fed with contaminated water will have diarrheal diseases, vomiting, and they deplete their reserves of nutrients. So when an acute crisis, like we're seeing now, emerges, it tips them into severe acute malnutrition. The role of women in many parts of our society in terms of their economic empowerment, their voices, and their choices in feeding their children. Climate change, like my brother Dr. Simba mentioned, which is very insidious. It's a wicked problem because it is there, but it is not there. We don't see it, but it's affecting rainfall patterns. It's affecting productivity of agriculture. It's affecting our food systems and wastage, and the insecurity that is bedeviling some parts of our country that's affecting production. As a consequence, we have heard now the numbers that MSF mentioned. But MSF is one part of an effort to respond to this. And as a government, I think a year ago, one of the first things that this administration did was to set up, activate the Food and Nutrition Council in line with the President's agenda to address nutrition, and is chaired by the Vice President, has a multi-sectoral composition, Ministry of Agriculture, Planning, Health, Education, to start to address these long-term systemic issues of malnutrition, alongside the President's incredible commitment to expand production of food. And he said it, and I believe that my sister will share with you what Ministry of Agriculture is doing. But even today, at the National Economic Council, as the excellencies will say, the President is about expanding production of food. That, in the short term, but also in the medium term, will go a long way in addressing this challenge so that Nigeria doesn't have to beg for food over time. It is possible, and this President said we can do it, and we're on the path to do it alongside the governors. In addition, his economic management team set up an economic emergency task force, which is chaired by His Excellency, the Governor of Niger State, and we've been meeting. We met several times, even before MSF raised this issue, as government, and some of the aides of the governor are here, to really go deep and say, how can we tackle this issue? And His Excellency, I'm sure, will say about the work of this task force. The Ministry of Agriculture, of course, has not relented. And for us in health sector, the acute crisis that was manifesting in this lean season, we set up a ministerial task force, which met a few weeks ago, And we had a multi-sectoral group, including diversity of our development partners, and said, it's not about talk, let's do. And there are specific things that we did through the task force, knowing that it's not only the issue of acute malnutrition of children, but also of mothers, because a malnourished mother, her child is likely to be underweight, preterm, and at risk of dying within the first year. So you have to also look at that holistically. And we mobilized 1.3 million doses of multiple micronutrient supplements that will serve 1.3 million pregnant women, and each one of them will have that for at least 6 months. I did receive confirmation that this will be arriving in this country by middle of July, and we're arranging the distribution of this multiple micronutrient supplements as an ad hoc initial step to provide succor as we go through the next 6 months, when we expect the projections of MSF and others they're saying that that's what will happen, but we'll hope to number it. But that's just a start. There is more of that will come, but in the acute phase, we mobilize that. We also restructured ANRIN. The World Bank resources are actually our resources. And we promptly, after the first meeting of the ministerial task force, understood that there were several states, Zamfara, Kebbi, a few other states, who were not part of that effort. We asked the Minister of Finance, within 24 hours, restructured the ANRIN program to mobilize $30 million that can be used to buy ready-to-use therapeutic foods, to channel them to 1,200 primary healthcare centers all across the country. We have a breakdown of where these primary healthcare centers are, and we intend to leverage that $30 million with $30 million of grant financing from UNICEF's Children Nutrition Fund, which they confirmed to us. And my brother here, Dr. Simba, he was there when they made the pledge, so that we raised $60 million that is immediately can be deployed towards buying ready-to-use therapeutic food and other things. This is not to say that we did not have, if you look at our budget in the Federal Ministry of Health, even as of late last year, we included counterpart financing for ready-to-use therapeutic foods to actually provide support for our children who are suffering from acute malnutrition. We are also expanding our primary healthcare system. Today, I had the honor of chairing the Ministerial Oversight Committee for the Basic Healthcare Provision Fund, where we approved $11 billion to be channeled to all the states of the Federation to strengthen their primary healthcare system so that they can provide basic services. I'm saying that because the children with acute, His Excellency, the Governor of Athena State is here, so I would like to welcome you, Your Excellency. Welcome, Your Excellency. So, I want to make the link. I want to make the link between what we are doing on primary health care with issue of malnutrition. Because the treatment of acute malnutrition is in primary health care centers, which have to be functional, have the staff, and today's approval by the MOC to disburse resources is to empower the primary health care centers and their workers to have resources to prevent before it becomes even acute. And the 1,200 facilities that are treating some are going to be among them. And beyond that, there is a multi-sectoral effort that this administration is pursuing, which includes the role of the Women's Affairs and what they're doing, colleagues in education, as well as the school feeding program that is being revamped alongside the social investment program that is also being revamped so that we can provide succor to our population. All in all, what we are witnessing is a trend that has been going for some time, and there are underlying systemic reasons, and the spike in acute malnutrition is for a period with the mechanisms and the vision of the president to expand massively food production. Over time, Nigeria can be able to produce what it needs. In the short term, we do have interventions of the federal government, and the presence of their excellencies, the executive governors, allows us to say with confidence that state governments are also complementing, and we ask your excellencies to support all those treatment centers in your states, and we can provide the specifics of where they are so that the acute phase can be addressed, because as you all agreed and His Excellency has directed, that we work together with states to address the needs of Nigerians. That is the way to manifest this renewed hope that is in our future. So thank you very much, and thanks, Osita, for inviting.
Thank you very much, Honorable Minister. Please, another round of applause for the Honorable Minister. Thank you very much, sir. According to Helen Keller, yes, we can have her now. According to Helen Keller, she said, alone we can do so little, but together we can do so much. I believe that this collaboration we are having in this meeting tonight underscores the importance of collaboration in solving an important issue like malnutrition. So at this point, we will be having the World Bank's representative, Dr. Ridgard Tilly Giado. The IT, are we good now? You're welcome, Ma. Okay, once again, my apologies. I'm sure that very soon we would have her. We are just trying to sort out the technical issues. So right at this point, we will be welcoming the representative of the Honorable Minister of Agriculture, Senator Abubakar Kyari, who is being represented by the Director of Nutrition and Food Safety, Mrs. Sugra Mahmood. You're welcome, Ma. Please a round of applause for her.
Thank you very much. I would like to stand on already established protocol so that I don't go wrong somewhere. Your Excellencies, Honorable Ministers, distinguished ladies and gentlemen, I'm here to represent my Honorable Minister, Senator Abubakar Kyari, CON, who is unavoidably absent, and he would have loved to be here, but he's on another assignment right now, and he sends his apologies. We've heard the numbers on malnutrition, and they're not pretty. And it would have been nice to be here on a different occasion. It's not a pleasure, let me say, to be here, but it is something we have to do to discuss this terrible problem that we're facing and what we are doing about it. So I would like to read the address of my principal, and it goes thus. It is with an immense sense of responsibility that I stand before you today at the launch of addressing the looming national food crisis and malnutrition surge in northern Nigeria. This event is a testament to our commitment to ensuring the health and well-being of our citizens through improved nutrition and food security. We're not delighted to be making a comment here because this is not a really happy occasion for us. It would have been better to be celebrating other successes instead of the numbers that we're looking at. You've heard the CADA harmony, the terrible statistics that have been reeled out. I'm not going to do that again. And what are the things that are predisposing us to these things? Persistent violence, including armed banditry and kidnappings, which have displaced a large population and disrupted livelihoods, early marriage, high childbirth rate, and climate change and environmental challenges are among the factors leading to the surge of malnutrition in northern Nigeria. Other identified contributors to the malnutrition include a lack of coherent coordination amongst the key stakeholders, the absence of sustainable funding mechanism, and growing dichotomy between the regions. Different things are fueling and driving malnutrition in different regions, but the North is the worst off for it. Despite these challenges, there are ongoing efforts by state and non-state actors to ameliorate the rising nutrition crisis in Nigeria. The federal government, His Excellency President Ahmed Bola Tinubu has already declared a state of emergency. The state governors have been doing their bit, and we've been collaborating. Since my ministers came on board, they've been reaching out to the state governors, and I'm happy to say that they've been responding, because we have had the pleasure of hosting them to come and discuss how we are going to collaborate together. The vertical collaboration from the national to the subnational is key in getting us out of these doldrums. And also the horizontal collaboration with ministries and other agencies, such as Ministry of Health, Women Affairs, Water Resources, and the rest of them, that is very, very key to us getting out of this. So he has said something about collaboration, about Helen Keller, saying if we want to go far, we can go alone, but if we want to go far and very fast, we need to go together. So this is why the Ministry of Agriculture and Food Security, under the able leadership of our Vice President, under the Nutrition Council, have been collaborating with all the key stakeholders to make sure that we get out of this. Like I said, we can't do it alone. We are collaborating closely with other key ministries such as Health, Women Affairs, Water Resources, Trade and Investment, Petroleum Finance, and Budget and National Planning. Petroleum needs to come in because the crisis of the living crisis we have and the energy crisis is one of the things fueling the cost of food and the inflation that we're seeing, food inflation. Today, I would like to present to you some of the things that we've been doing and that span the short, medium, and long term. Agricultural production and mechanization. In the short term, we are providing and distributing improved seeds, varieties in legumes, cereals, and fruits and vegetables. And also, I'm sure you are all aware that we've got a donation of fertilizer from Central Bank to distribute to farmers free, which we've been doing along with the state governments. Production of diverse and nutrient-dense foods. Now, we have been distributing seeds for free, and we have reached out to the state governments. They have joined us to support the farmers in distributing different inputs for them to be able to go back and rejig their operations. Then enhance support for homestead garden and livestock production. Homestead garden is very important in the sense that those vulnerable households should be able to produce a few things in their backyards of the nutrient-dense food for alimentation. We've been promoting that as part of the food system transformation agenda, what has been prioritized by Nigeria to be able to get us out of the doldrums. Medium term, improve mechanization, irrigation, and water management for production of nutrient-dense food. Again, we cannot do it alone. We're doing it with the state governments. They have their state dams. The federal has, Ministry of Water Resources. We're all collaborating to push this agenda forward. Promotion of technology-enabled urban agriculture is driven by innovation and passion for our youth and women. This again is something we are going to be pushing in the very near future. Increase input financing and microcredit for the production of nutrient-dense food. Again, we are repositioning the Bank of Agriculture to be able to support farmers in production. We are collaborating with Bank of Industry to be able to support the midstream and downstream sectors, which are the processing and value addition, as well as marketing sectors. Long term, development and promotion of cooperative models for impactful agricultural development. We are also establishing animal disease-free zones and compartmentalizing the local and export of livestock and livestock produce. Biofortification and food fortification. Together with the Ministry of Health and other development partners, the ministry has been biofortifying our varieties, so crop varieties, one of them being provitamin A maize, orange fledged sweet potato, iron and zinc sorghum and millet, vitamin A cassava and iron, and very soon we are going to have zinc rice. Now, what is important about biofortifying is that we have realized that farmers retain what they produce. The smallholder farmers that feed all of us, they retain what they produce. So one of the easiest ways you can kick out malnutrition at scale is to have them produce biofortified crops. Our National Food Consumption and Micronutrient Survey, the biggest ever in the world, has shown us that we have areas of micronutrient deficiencies: iron, zinc, and vitamin A. I think some of the B vitamins, 2 of them are also there. So we have biofortified several staples to be able to make sure that we are getting it at source, because some of the food fortification at the manufacturing level may not get to the rural areas. So, but if farmers produce what they eat and retain what they produce, and that is biofortified, then we can begin to move the needle in the right direction. And also, one of the things is climate change has been mentioned. We have rice varieties that are flood tolerant, Faro 66 and 67, and these are being supplied to farmers for free. And I would like to also request that our state governors, who are doing a lot, also key into this to support farmers that are producing rice. Now, working with the Federal Ministry of Health and Social Development and other stakeholders, we are also promoting large-scale food fortification. We've done, the country has done sugar, vegetable oil, sugar, and salt. Now we are going to do rice. We've already done the pilot, and we are getting all the millers involved to be able to biofortify, to fortify rice.
Hello? Can you hear me? Unmute your mic.
So long term, in collaboration with one of our partners, Harvest Plus, and our research institutions, the ministry is working on biofortifying rice varieties, which will be ready by quarter 1 of 2025, hopefully, if things go according to plan. Collaboration and partnership, I have touched on those ones. We're doing it at the vertical and horizontal level. And the states are great partners in this. And we are trying to also revive school farms to enhance food security and also get our young people to catch them young, to be able to know that agriculture is important and not a poor man's job, and we need to change the labor composition of that sector to be able to survive as a nation. Now, medium-term collaboration with stakeholders to promote locally produced nutrition commodities. The Honorable Minister of Health has touched on that, ready-to-use therapeutic foods and also ready-to-use supplementary foods. Now, RUTF, 60% of that is groundnuts and milk, and we're importing. I'm not a happy camper about that, and we're working with other key stakeholders, our research institute, our groundnut farmers, our dairy farmers, to put a target. When can we be able to produce evaporated milk in this country? When can we be able to produce aflatoxin-free groundnuts that has the oleic content that will give UNICEF and WFP and every other person that is buying RUTF that level of confidence and quality that we need for our SAM and MAM cases. That is what we're doing. Now, I see the host looking at me. I'm taking too long, but you're talking about nutrition, sir, and nutrition starts with food. That nexus with food, I have to explain it very well, okay? I'm already in injury time. So, revival and promotion of home economics and food and nutrition knowledge transfers and practices at the state and local government levels. We are working with Her Excellency, Senator Remi Tinubu, on this issue, and the wives of the governors will soon come knocking, and we expect the husbands to give us full support to be able to do that. And we're very sure, I can see Governor Zamfara, my senior, smiling there. Collaboration and with Nigerian Meteorological Agency. We are collaborating, we have an MOU with NIMET to be able to downscale weather information to farmers. And this, we also need the states to support. Long-term establishment of various data collection tools and platforms. If you're doing guesstimate when you're planning to fail. So we are putting in place different data collection so that we can collect data for different purposes to be able to service and give us that evidence-based policy programs and so on. Food safety and post-harvest management. You know that for the perishables, we lose 40 to 50% depending on who you're speaking to after production. That means farmers are investing, but they're losing 40% of their investment post-harvest. That has to stop, and we need everybody to support us on this because it's going to require infrastructure on a very, very serious level, cold chain, logistics, and storage for us to be able to make it happen. So improvement of agronomic practices, horticultural and livestock management, pest and disease control, including on-farm food safety measures through training and retraining of stakeholders, farmers, processors, and the rest of them. Medium term, we have to enhance post-harvest handling and storage of food to avoid the losses. I've talked about that. Establishment of milk collection centers. Milk is one of the cheapest source of protein you can get. Our children need it, and you've heard the numbers of Sam and Mom. So we need that to happen, and we need sustained investments. Long-term, upscaling and outscaling all of the various programs that I mentioned out here today. We need to do that at scale, at the subnational level. Food security and resilience. Short-term, National Strategic Food Reserve procures and stocks essential food items for distribution to vulnerable communities when we need situations like this. From 2020 to now, we've been releasing on a regular basis food from the strategic reserve. Now, by law, the federal is supposed to keep 5%, states 10% of buffer stock. I would like to say that we need to do this together, and any other person that needs to support will also need to buy and keep in case of the kind of situation we're seeing now. It is for getting people to become food secure, and it is also for price stabilization. Now, improvement of infrastructure and systems for crop and animal aggregation, transport, storage, and distribution. These are all post-harvest things that we need to do. And we are doing some of them, but we need partners to key in and support, because obviously our national development plan says 85% of the resources we need is going to come from private sector, 15% from government. So we need everybody in the room, all hands on deck. By leveraging the direct and indirect connections between agriculture and nutrition, such as food production, family income, food prices, and women's empowerment and environmental health, we aim to catalyze systemic change and to reduce the unacceptable high rates of stunting, wasting, and micronutrient deficiencies, ultimately addressing malnutrition in all its ramifications. This event will provide a platform for all of us to have this critical conversation and to make sure that we are forging ahead very quickly. The expected outcomes, of course, is this interaction will include increased public awareness, identifying existing actions plans, and encouraging immediate coordination of the various actions at all levels. I would like to extend my heartfelt gratitude to all the stakeholders involved in the initiation and launch of this program, spearheaded by the Athena Centre for Policy and Leadership. Together, we will continue to work towards a Nigeria where no child goes to bed hungry and no family is deprived of the basic right to food, and to foster a healthier and more prosperous Nigeria. Thank you very much, and God bless Nigeria.
Thank you very much, Ma. You would agree with me that malnutrition is about food, and she has to give us that breakdown very well. Please let me celebrate her once again. Ladies and gentlemen, please permit me to welcome one of our very special guests in our midst, the Governor of Athena State. Ladies and gentlemen, His Excellency Governor Malam Diko Umaru Rada, PhD. It's great to have you in our midst. Distinguished guests, you would agree with me that any event that brings this number of distinguished people, especially our governors, in one room must be a serious event. Please let me celebrate the Athena Foundation for making this happen. Before we proceed, we would like to give just 45 seconds at this point to the World Bank representative to just quickly share. I'm sure we've handled those technicalities now. The IT, please.
Good evening, can you hear me?
Yes, we can.
Okay, excellent. Good evening, Your Excellencies. Permit me to also stand on existing protocol. In the spirit of also having 45 minutes, I hope I'll do justice within this time. Like the speaker just before me has
sorry,
said,
Ma. We said 45 seconds, so it's just a brief. We're sorry about
45
that.
seconds.
45 seconds.
Let's raise
Thank you, Ma.
45 seconds. That's
Okay,
it.
sorry
That's even
to
more
interrupt you
rapid.
again. From the Chancellor of Athena Foundation, you have 5 minutes now. So go ahead, Ma.
Thank you for that, Grace. So in the spirit of, like the speaker before me had said, this is not necessarily a pleasant occasion, but I think the coordinating Minister of Health and Social Welfare has set the tone right, that this is about solutions. It's more than about dialogue. It's about how we can spur action to tackle this emerging or I'll say budgeting crisis. And this is not a crisis of today. I think that's also been said, but I'd like to offer a dual lens to the crisis, that we have malnutrition basically behaves like a running tap. You have a running tap open, the floor gets flooded, you mop up the floor, but if you leave the tap open, then you're going to continue mopping up. So you need to do two actions, you need to multitask. You need to do two actions at the same time. One is to mop up the floor. So those that are malnourished today, what do we need to do about that? Secondly is you need to close the tap. So those that are not yet tipped over into malnutrition, how do you address that? We've also heard about the drivers and their immediate causes of the current crisis, but also immediate causes of malnutrition. So we have a baseline, I think, challenge that is is national. We have 1 in every 3 children that are stunted in the country, and 1 in every 10 children that suffer some form of wasting or even severe acute malnutrition. Now, when we think about it, we think about death and illness and the immediate effect of acute malnutrition. But the additional reality is that after acute malnutrition comes chronic malnutrition, by which the indicator is stunting. And when we're thinking about beyond humanitarian, but our economies and development, that stunting becomes a very significant predictor of our human capital accumulation, and therefore a potential of our economies to be productive. The data is there, the evidence is there globally. It says basically that for investing in malnutrition programs, you can increase school completion rates by a year. You can raise adult wages. So those who you invest in today have between 55 and 50% potential increase in their wages as adults. They're 33% more likely to escape poverty. And the coordinating minister has also said it, that underlying this is a broader sort of, dependency ratio issue. And for the economy as a whole, for sub-Saharan African countries, we're looking at potential economic gains in the range of 4 to 11% of GDP. So it's not just a health imperative. It's not just about hunger. It's about human capital. It's about the economy. It's about how productive this country will be in the future. And as a sort of proxy, you've heard about the Human Capital Index, which basically defines the extent to which a child born today will be as productive as an adult if they enjoy full education and health. And for Nigeria, that index is 0.36, which means that a child born today will be 36% as productive as it could be in its adulthood. So I think the framing is there, the evidence is there, and the reason why it matters. I'd like to just drop also a final statistic before I go into solutions from the Copenhagen Consensus. Oftentimes when we have to make fiscal choices about where to invest our money, there is a temptation to look at programs which, and rightly we should invest in every sector. There's a temptation to look at sectors in which we think there's a direct sort of derivative economically for households and for the community. But as an example, the Copenhagen Consensus compares investing in rail, which has a cost-benefit ratio of about 1 to $1, to investing in, for example, malnutrition programs, especially preventing malnutrition. You see a cost-benefit ratio of about 14. So just to bring it into numbers, that what we're doing today really matters, but that we start today, we tackle the crisis of today, but we also don't stop because there is gains for us further down the line. Now, in response to this, the World Bank in 2018, at the request of the Federal Ministry of Health and Social Welfare, appropriated $230 million of IDA, and also mobilized about $7 million of grant financing from the Global Financing Facility. This was also supported by partnerships, close to $10 million from the Aliko Dangote Foundation, Bill and Melinda Gates Foundation, Power of Nutrition, and was really a coalition of partnerships to work with Nigeria to see how we could, along the journey of building human capital, prevent malnutrition. And as you focus on prevention, it's not just preventing stunting. On that same results chain and pathway, the science is that you will end up averting wasting cases as well. You will avert deaths if you are investing in the right interventions. This IDA was allocated to 12 states who expressed interest, who had put in place the policy framework, who themselves had committed to putting about $50 million into nutrition programs in their states. They had set up some institutional architecture to be able to roll this out. And since then, they've continued to deliver services. I think the power of this investment has been really that they've delivered services at the last mile. I know a few of the states that are here, Kwara and Niger, are all part of this initiative and delivering services at community level. So till date, from the time when service delivery started around 2021, over 15 million Nigerians have been reached with preventive nutrition services. And these are focused on pregnant women, on children under 5, so the most vulnerable, and adolescent girls. Recently, based on the crisis, the coordinating minister, as he said, convened a multi-sectoral task force to look at how we can respond in the pockets where there are still significant numbers. And of course, we know that with the lean season, we expect that these numbers will deepen. And we hope that this year will be the last when we have a deepening and we can start to roll back from here. And so the federal government has asked for restructuring of ANRIN, which will immediately unlock 30 million of IDA to not only buy the commodities, but also make sure that that service delivery is happening through primary healthcare centers. So focusing on treating those who are acutely malnourished. There are other initiatives, other sectoral initiatives. We've heard some of them from Ministry of Agric and Food Security to really treat this in a multidimensional way and tackle this in a multidimensional way. So this includes some of the cash transfers that are ongoing, intended food assistance and food transfers in the short term. Also looking at where there needs to be preparation for the next agricultural season, so that when we get to this period next year, we're not talking about food shortages to the extent that we are now. So I think really, I'd like to just round up here because I know we'll have time in the panel discussion, but just to say, yes, there is a fire burning today, here and now, and we should really deal with it, but we should not assume that the fire is out because it becomes ashes. Going out from here, from this period, I hope this will be an opportunity for us to really put malnutrition on the development agenda of each and every one of our states. I couldn't share my slides, but I did a correlation of the National Common Entrance examination scores with the stunting prevalence of states. And there is a very strong negative correlation. So what we do today really matters for the immediate future, for the medium term, the long term. And I'm confident that with this sort of powerful partnership, we have almost every sector of society represented here, that we can forge ahead with very positive solutions. Lastly, I'll say that I think we have the right leadership in country under the National Council of Nutrition with the Vice President, bringing together all sectors to coalesce around this agenda. So I really believe that we are well poised over the next few months and years to turn this around, starting with what we commit to today, especially at the subnational level. So let me stop here and hand back to the moderator. Thank you.
Thank you very much, Dr. Ritgal. We appreciate that presentation. Please, very quickly, and by the way, we really do appreciate what you said, because you said there's a fire burning, and the truth is that fire is the energy in this room that will drive malnutrition away from Nigeria and drive us into prosperity and food security. Please let me celebrate her once again. Thank you very much. We would be going very quickly into the panel discussion, but before we do that, may I humbly recognize the Deputy Governor of Kebbi State, Senator Umar Abubakar Tafida, who is representing the Governor of Kebbi State. Let me celebrate and appreciate him. You are welcome, sir. And then lastly, we also have the National Program Manager of National Homegrown School Feeding Program, Honorable Mrs. Anjo Obande. You are welcome, ma. Please, may I now hand over to the Chancellor of Athena Centre for Leadership and Policy. Well done, sir.
Thank you very much, Your Excellencies and Honorable Minister. We've had the conversations, we've created the background, and we're confronted with a situation. I like how Ritzgag stated, fire is burning. The water is on the room. We need to mop it, but we also need to turn off the tap to allow it to stop the water from running. So I would like to start from the way you are seated, from Zamfara down, to ask this, to just respond to this as we go into this conversation. One is just briefly tell us what is going on in your state on the nutrition space and the malnutrition issue. And we would like to know who is really gathering the data in your state, because sometimes all this foreign data we have, extrapolations, we also want to know whether there is any local data that we are dealing with that is being collected by the government. And do you have a coordinating system in the state, just like the National Council on Nutrition? Is there any such thing in the state so that we can see how this can come together at the state level? And is there a plan, a state plan on nutrition? Because we want all the stakeholders here to go away knowing what is going on and how we can begin to bring the synergies. So that will go for every governor and your first round of interventions.
Good evening, my colleagues, executive governors, Katsina and Niger State, as well as the Deputy Governor of Kebbi State, my very good friend, the Honorable Minister, as well as the representative of Minister of Agriculture, my friend on my left, Dr. Simba, and the convener of this program, Dr. Osita. Thank you very much. Let me say this. There is no better time to have this kind of program than now, because we're talking about Northwest. If you look at Northwest, it's an agrarian economy. And let me narrow it down to Zamfara. I can say that 90% of Zamfara are farmers. And in the past, we used to produce enough for our own consumption, as well as for trading. And I always confidently say that we used to feed the entire Southwest at a point. However, the story has changed. Today, even the one to produce for consumption is becoming difficult. Why? Because of the insecurity challenges the state is facing. We all know that Zamfara today is facing issues of banditry, kidnapping, cattle rustling, and all sort of criminality. And that has made it near impossible for our peasant farmers to get to their farms, produce even what they're going to consume, talk less of for commercial purposes. And that has caused serious challenge, especially in the area of malnutrition. Let me say this. Yes, Osita, we put in place measures where we capture data in terms of the number of malnourished children. As at last year, in November 2023, we had over 143,000 children that were malnourished in the state, out of which we're able to do what we can, but over 307 of them died because of that. And that has caused for concern for any responsible government to begin to think of what will be the way forward in order to avoid future recurrence of such and keep our children healthy and so on and so forth. And yes, the data is in place. And my humble soul went around all the 40 local governments in Zamfara State to understand the condition of malnutrition in each of those local governments. So I can say that I have first-class information as to what is happening there. And therefore, we're making conscious effort to make sure something is being done in order to address the situation. And this is ongoing. Thank you.
The same. Thank you very much, Mr. Osita, and I would like to recognize the excellencies that are here, including the junior governor here, close to me. Excellency, the Honorable Minister of Health and the representative of the Minister of Agriculture, His Excellency, the Deputy Governor, distinguished invitees, ladies and gentlemen. I think this topic, malnutrition, is one of the burning issues in the northern part of the country. And that you cannot differentiate or remove poverty away from malnutrition. And also, you may not remove agricultural productivity from malnutrition, as said by the representative of the Minister of Agriculture. Agriculture has been the mainstay of our people. As mentioned by the governor of Zamfara State, about 90% of our population are peasant farmers and subsistence in nature. So their ability to produce food is based on other factors. There is climate change, there is issue of insecurity, there is issue of other factors associated to capacity and what have you. So I think for us to address the malnutrition in our society, we need to link it up with how to scale up production. As long as you scale up production, you can be able to fight malnutrition as much as you can. Provision of employment opportunity to our teeming youth is also one reason, one factor that we need to consider as government. But when we came to statistics as to the number of malnourished child in our society, you cannot run away from the fact that people are running to helter-skelter to get what to put in their stomach. They are not even talking about what is the content of the nutrient in this food or what is the content of this in this food. But what they only want to do is to kill the hunger in their stomach. And when you go to our hospitals, it is really very sad when you see a pregnant woman but scouting to find what to eat or to put into her stomach. So what do you expect of the baby that will come out of her? It is really very important we look at all these factors. For us to address it squarely, we need to provide, empower our women to produce at the backyard of their houses, see how we can provide credit facilities to those rural dwellers to see how they can be able to earn a better life through increasing their productivity. And in Katsina State, we have introduced the e-health solution. The e-health solution is which gives you a comprehensive record of all those people that visited hospital. We have started it with the secondary and tertiary institutions, and we want to scale it down to the primary health centers. And also to address those issues, we are also in the process. As at today, we want to have functional primary health care in all the 361 wards. Right now, we have started construction or reconstruction of about 102 primary health centers in the state to make them functional, in the sense that they will operate for 24 hours and address mostly maternal and child maternity issues. So I think with all these things put in place, we'll be able to come up with a genuine data of malnourished child, how we are reducing it, and then also we should have a comprehensive and a clear data or numbers as to those people affected by this issue. And I think it is important because when we came on board, what we first did was to have a baseline survey on all our health institutions. Because without getting the real data on all these issues and having a comprehensive report as to what is wrong and what is right and what do we need to address those issues, you may not be able to get it right. But I think putting all these machineries in place will be able to give us opportunity to have the numbers accurately and in a better way, and then that will drive us to see how we can help to reduce the malnutrition in our children and also hunger in our people. Thank you so very much.
Thank you very much, my colleagues from Zamfara, Katsina, Deputy Governor, Kebi, my brother, the Minister of Health, our Permanent Secretary, Minister of Agric, and the organizer of this program. Let me confess, when I was invited here, I was trying to understand the correlation between malnutrition, hunger, famine, whatever name you want to call it, and health. So I was trying to figure out where to put this topic. Is it in agric? Is it in health? Now, when you talk about malnutrition, you will first talk about feeding, food. So agric will come first. But the quantity or the quality of food you eat now, the nutrition will come in there, how to balance it. Now, seriously speaking, this conversation has been going on, and as we came to government in 2023,
we thought it was very wise for us to diversify the economy of our state, to improve agriculture and agricultural production to a level that it will be mechanized and it can take care of us and others. As I'm talking, Niger State alone has more mechanization than Nigeria as a whole. We have more tractors than the Federal Republic of Nigeria. We have more irrigation facilities than the Federal Republic of Nigeria. We've done a lot in agriculture in an attempt to boost production. Now, we have partners. When we were talking earlier, you said Harvest Plus. We've gone into partnership with Harvest Plus and even ITTI on production of some kind of nutritious maize with a lot of vitamin A's in them. Even our cowpea with more nutrients, to boost nutrition in a way that we can have a value chain in nutrition through the maize, the yellow maize, and also the cowpea, the soya, so that the common people can really have nutrition in their diet. Again, this is to the World Bank, to UNICEF, and even the federal government of Nigeria. I was very impressed when the permanent secretary was talking about the strategy for reserve. While you were talking earlier, you spoke about the causes of why malnutrition or famine or hunger is everywhere. It could be as a result of population explosion, natural disasters, climate change, insecurity, economic shock, etc., etc. Yes, these things are factors, but we've studied year in, year out the attitude and characteristics of Nigerian government. When you talk about, and this is the Ministry of Agriculture, you are talking about strategic food reserve. You can't reserve what you don't have. So I think a conversation around what is called reserve. Reserve is extra. Now, there must be a deliberate attempt by the Federal Ministry of Agriculture to either import food to reserve so that they can shock inflation and stabilize price, or, and which is the best, to crop for strategic reserve. As a government, we've written to the Prime Minister of Agriculture. I'm so surprised that till tomorrow they have not responded, that we have cleared 1 million hectares of land and we are strategically positioned to farm, to crop for the strategic reserve of federal government of Nigeria. Now, secondly, the World Food Program also, anytime they come to mop food in Nigeria, inflation skyrockets. They would come with dollar money, mop the food that is available for the people to consume. Therefore, cause scarcity and crisis in the system. This we have also approached them to say, let us crop for you. And this will solve these problems. So the conversation is, I'm happy it's starting here, but it must continue. We must scale it up. What are the root causes of this crisis? When people don't have food, they will fall sick. When people are well fed, they hardly fall sick. So the symbiotic relationship between nutrition and feeding and health is very critical. So as a state, we are working assiduously in finding solutions to the root causes of this crisis. We have provided solutions to the federal government, especially Prime Minister of Agriculture, to come in partnership with all the states. Staple crops, there are institutions here who have done a lot of research in adding more nutrients and vitamins to some staple crops that are good, for nutrition. And we have not seen these seeds in the market. What is happening? What is the primary role of Ministry of Agriculture in terms of shocking the gap between demand and supply? The seeds are not there. The inputs are not there. Even if you have money, you cannot find it. So the demand on the people is more than what the people can take. It should be vice versa. The demand should be on the government. And the government here, we're talking about Federal Ministry of Agriculture. They need to step up their game. They are just releasing fertilizers to the people. It's getting late. As a government, we have lost 3 seasons. In this country, we have not done dry season farming in 2023, 2024. This is disastrous. And we're talking about strategic grain reserve. Where are you going to get the grains from? You are not cropping. So we need to sit down and understand how much of land do you need as a federal government of Nigeria in Niger State to crop for you for strategic reserve? How much is going to the market? So, Mr. Osita, I'm very passionate about this issue, and when I come to this kind of program, I hate to take so much time, but I wish this conversation is going to scale up, in a better, in a smaller or larger, forum where we can talk to details. Then finally, the Ministry of Health is doing very, very well in terms of primary health care and also provision of nutrients or vitamins to people who are under, they call it acute severe malnutrition. Is a very, very important thing. But this is the first stage. I see it as how do I say it? Preliminary stage. There is need for us to be deliberate about this. And being deliberate about this is to work, for example, in Niger State, we have been able to generate data through our primary healthcare centers to understand the gaps between people who are hungry, people who are malnourished, people who are displaced. This data is helping us to understand what we need to invest in our primary healthcare centers. For instance, we provide more of food in our PHCs than medicine. So we make sure that we give 3 square meals to those that are in PHCs than to give them Panadol or paracetamol, because they are not actually sick. They are just hungry. So, that's the medicine. So in the interim, yes, vitamins are very important, but in the long run, people must be fed. Thank you very much.
Your Excellencies, Your Excellencies, the executive governors of Katsina, Zamfara, and Niger, the Honorable Minister of Health, Permanent Secretary for the Ministry of Agriculture, the organizer of this program, ladies and gentlemen, good evening. I'm here representing the governor of Kebbi State. And in Kebbi State, since we came in, we are doing a lot to ensure that the level of hunger and poverty is reduced to its barest minimum. When you are talking of malnutrition, the first thing that you will have to address is hunger and poverty. And how do we do that? Is by assisting our farmers to produce what they can eat. As at now, the problem we are having due to insecurity challenges in various states in the north, and also other economic factors, a number of farmers cannot go to their farmland and farm. We need to secure our farmlands to give our farmers the assurance of safety before they'll be able to go back to their farms and farm and cultivate and produce for them to eat, for them to feed themselves. The issue of assisting our farmers with seedlings and finance to take off and cultivate their farmlands in the rainy season and dry season is key. Because where our farmers will not be able to cultivate their farms and produce something for them to eat, there will be nothing that will be left for them to sell to others that are not, are doing other businesses that they cannot go, they don't have farmlands to go and farm. They are doing other businesses, which are based on the profits they get, they will come back and buy from what the farmers produce. Where a farmer can not be able to produce, will not be able to feed himself, then there will be no surplus for him to sell. And that's why we first and foremost said, okay, let's see, how do you do that? To give fertilizer free to our farmers, to give them seedlings, both local seedlings and improved seedlings that we're able to reach out to, and little finance for them to go back to farm, for them to be able to feed themselves. And where their surplus will be able to sell. Where a farmer is able to produce and feed himself, then the question of hunger is gone. The level of poverty will be minimized. And when there is no hunger, no poverty, the issue of disease as well will equally go off. But where there is no food and there is poverty, of course, certainly hunger will come in. And that is why we talk of acute and severe malnutrition. And at this point, I'd like to call on, the federal government, the state governors, not only those that are the ones in Northwest, and also the development partners, that something needs to be done to come in and assist, our farmers in the north, with improved seedlings, finance, and all that is required for them to go back and farm, during both dry season and rainy season. And by so doing, I believe the situation will change. Where, like Niger State Governor said, where we are able to produce something and feed yourself, then the question of, talking of being malnourished will still not be there. Where you are hungry, then you're not talking of nutrition. Of course, you are hungry, which means already, there is room for any disease to set in. Yes, so, but that's what we are doing now in the state. We are doing a lot to ensure that we assist our farmers, and they have gone back, to their farms, and a lot, is happening. That's improvement from what we made on the ground. The Kebbi State Primary Healthcare Development Agency is also there on the ground with units established in each and every ward. And they're collecting, we're having data from them on the position of malnutrition in the state. Thank you.
Thank you very much, Your Excellencies. And I think this has instigated something very critical, and the conversation about nutrition is linked now to agriculture, food production, which is key and fundamental. But I must add that in most crises you have in every country, there's always examples around the world. And we've seen examples of countries where they had issues of acute nutrition challenges in terms of malnourishment. And Brazil, Peru, we've seen cases in Southern Sudan, and we've seen how people have rallied together in a health-focused approach to solve the issue of nutrition, at the same time solving the larger issues of food production. So where we are today is that from May to October will be a challenging period in Nigeria. The number of people that will be hungry this May to October between the harvest seasons is going to be acute. So we need something to happen now. So before the foods grow, before we chase out the bandits in the farms, before we provide more irrigation to the farms, before the tractors get in there, something needs to happen. So, Minister of Health, what is going to happen?
Thank you. So I think this has been an extremely interesting conversation. And thank you to Your Excellencies for very engaging contributions. And it reminded me of what Athena Centre, who is the Nobel laureate on economics a few years ago, who wrote Development as a Freedom, that poverty is one of the most greatest unfreedoms, and what we're dealing with here over a long time. But he also made the point, after looking at famines over 50 years across the world, that no well-governed space actually experienced famine at large scale if it's well-governed. And it's an exception, and you can look over that. So, which brings the question of the governance within our fiscally decentralized system. And the issues we're dealing with agriculture, nutrition, health, they require federal government, states, local government, civil society, private sector, all hand in hand in the spirit of cooperative federalism. And I think that's what the president is also trying to move us in that direction. So His Excellency, the Governor of Niger, was saying the Ministry of Agriculture had a lot of responsibility. My brother, the Minister of Agriculture, is not here. So I have to respond in that sense to say that it requires the Ministry of Agriculture at the federal level, and they're doing a lot in expanding infrastructure, inputs, and the path to improve the production. But we also realize that the land is at the states, and there's a lot that could also be done. So that handshake between federal government and state is so vital to address the food security issue in our country. And that's just one point. But on the health side, I want to make a connection between malnutrition, services, and particularly reproductive health, and women and gender issues. A few months ago, I visited the field. I was out in the primary healthcare center somewhere in the Northeast. And a face still sticks in my face, a face of a young lady who, she's young, she was pregnant, she had a child who was lying in the hospital, obviously the child malnourished. She herself was malnourished, another child who was at the back. So she already had 4 or 5 kids, and on the way to the 5th one. That girl is probably didn't complete school, wasn't well nourished to start with, got married, had a succession of children. She bleeds each time. She hasn't eaten well. And her child, of course, will have intercurrent illnesses over time. So will have very marginal nutritional status. So imagine that child getting diarrhea. He gets tipped into very severe form of malnutrition and can die. So that's the link between what we're trying to do in expanding primary health care, to give her the ability to moderate her choices in terms of when she gets pregnant, spacing her children, breastfeeding her children, but also preventing things like measles. If you go to Borno, the Athena Centre that you run, you see lots of children who have had measles because they are unvaccinated. And that tips them over to acute malnutrition, because when they have disease like measles, they can't eat, they have diarrhea, they vomit, so then marginal nutrition just gets tipped over. And that woman who is malnourished because she's had multiple pregnancies, she's anemic because she's bled in pregnancy and bled again, the men don't bleed. And with that, her child is small to start with because the mother herself was small. So that's why we started with the multiple micronutrient supplements. And we mobilized with 1.3 million doses to start with. Our aim is to have at least 6 million doses, and that each woman who gets that will have for 6 months that supplement, and that's a pregnant woman. And that will provide at least some succor for those who are most vulnerable as we are addressing the bigger issues of production over time. And then for the ready-to-use therapeutic products and the supplementary feeds. Ridgeg mentioned the RUTF. We restructured RUTF to locally produce, to buy locally peanuts, milk, and others, but to be administered in the centers for treatment. Because a child who is severely acutely malnourished, if you give food to that child, he will throw up irregular food because his body has been conditioned to no food. It's that level of severity of malnutrition that child, if you feed them too rapidly, they get complications because their body has been destabilized. That's why they go to treatment centers. That's why there are 1,200 treatment centers in the country today. And we know them in each of the states. MSF in the 40, many are in your states as well. What we ask is that the state governors also ask your commissioners, map those facilities that are yours, invest more, support the health workers there in this acute phase, while the medium, longer term things. And finally, His Excellency the President approved a social action fund, which is hosted in our ministry, and I will suggest that when we are designing this initial phase, we use the states that are here with us. We work with you as a follow-up because we said our bias is towards action, where we put resources in the hands of communities and then empower them. Small amounts. It's a community demand-driven effort, not like NGKS, but which is much larger, because many of the communities, all they need is small amounts of money. They don't need big infrastructure, all they need very basic things. So we would just follow up as an outcome of this conversation with your states, maybe through the primary health care, to see what is it that we do. This is something tangible the President had approved. It's in our budget for 2024 as Federal Ministry, but it's complementary. At the end of the day, the states will have to shake hands for this to work for Nigerians. So thank you.
Excellent. Thank you very much. And this is really the goal of this conversation. I must say that when I first mentioned it to the Minister of Health, it was just supposed to be a conversation between me and him. And he said, no, Sita, we need to bring this to the states. You need to get the governors together because, yes, we have some funding, but it will scratch the topic. We need to get the governors and start with those who are here in the room so that we can start immediately. And I must say that this is a very interesting experience because as I contacted the governors, some of whom I have never met in person before now, they responded quickly to my call. They called back, followed up. The governor of Niger even became the organizer. He was telling me who to call, phone numbers, call this person, he's here, and that, And the Honorable Minister of Health was in Paris. I was sending him letters, he was signing it online, and we were pushing it. All this happened within 1 week to get all this together, and I am super impressed about this quality of governors in the Northwest. I'm super impressed because this is really the way to go. And as you can see, one of the major indices of government is not just what is being done, but what the citizens perceive the government as doing. It is important that people know that somebody is thinking about them. Because that's the key. Once people feel that there is no hope, nobody cares about me, the likelihood of descent to anarchy rises proportionally to that. So, Dr. Simba, before I come to the Ministry of Agriculture, just a quick, because we're wrapping this up because we're already getting a way forward that is practical, that can put things on the table. What do you suggest we do between the states and the federal government?
I think it's on now. I will not maybe address that very well because I'm not very well versed with how that works. So I'd be giving the wrong prescription. We have the people here who know very well how the states and the federal governments can work. But I can talk, again, I said I'm from Zamfara and I've lived in a village, Bagega, for a year. I ate their food, I drank their water that we're afraid to drink, and things like this. And I did a food frequency survey at one point to find out what kids ate, when they ate, and things like this. And very quickly I'll say this. What we're talking about is a fire right now, given all these things that we've heard and what we know that we need to address. Yes, indeed, I really appreciate the longer-term, medium-term and longer-term development initiatives, and I'm very impressed to hear what's going on right here. It gives me a lot of hope. But what do we do about the 2 million children who, if are not addressed today, they will die, for sure? they will incur neurocognitive deficits that follow them throughout their lives. What we do with the 6 million that moderately malnourished, that can be severely malnourished, right? So part of it is we look for small wins, and Your Excellencies here. And one of the things that the Honorable Minister said is, yes, you are very well versed with the facilities in your state, the primary healthcare facilities, right? Which are working, which are not working? Where can we invest a little more to catch those that might slip into severe acute malnutrition, right? And I think these are small wins. I'll give you a very quick example. I'll wrap it up here very quickly. To treat a child in an outpatient facility, and I like your food sort of analogy there, is even with Plumpinut, what we're talking about is about $59 a box. That comes to about 85,000 naira, right? To treat a child who is admitted, it is at least 3 times more than that. Now, if they have other complications that have been mentioned here, it becomes even way more expensive. So let us, to begin with, look for those small wins, catch them at that primary health care level. And for those that are severely malnourished, yes, we need more actors, we need more partners to come in and help stabilize them. Thank you.
Thank you very much. So we're wrapping this up. Governor of Zamfara, tell us in a brief what we need to do.
Well, this is a very interesting conversation. Let me say this. In Zamfara State, we have over 700 primary health care in the state, out of which only 65 are really getting this nutritional component to be able to take care of the people. That's one. 2, I think this is high time now we begin to focus or to pay more attention towards Northwest, North Central, because there's so much taking place in Northeast. I think focus now, including all our development partners, please, the focus will change. We need more, there's more crisis in Northwest, North Central, compared to Northeast. I'm also appealing to Honorable Minister here to understand the gravity of the issues we're facing in Northwest, as well as Federal Ministry of Agriculture. Therefore, funding should be more towards Northwest, North Central, especially with the rate of crisis and insecurity that's taking place, which is preventing people to have access to farm and be able to even grow what they can feed to take care of the people. That is my appeal to both development partners, Honorable Minister of Health, as well as Federal Ministry of Agriculture. Thank you.
Yes, Governor of Katsina.
Thank you very much.
Where do we go from here?
The conversation was very interesting, and that we have made a very, very important point very clear, and we have put them there on the table, yes, that we need to look at them critically. But I think the most important one is, as I was talking to the Niger State Governor before now, that in Nigeria we are good in grammar. Always blow grammar at every policy, programs, all these things. But I think it is really time for us now to do action. Rhetorics every time, and I think it is time for us to do action. And I want to assure you that we, the subnationals, we are ready and committed to this. Despite the malnutrition in this part of our world, I think it is really very important. And we are so glad with the Minister of Health because of the programs he has rolled out, and he has been doing very well. in the area of health, and we are also very grateful to the Ministry of Agriculture as well, because they have been doing the little they could. But I think it is time now for us to share this thing. As you are introducing these programs, the state governments are committed and ready to commit a counterpart funding to ensure that we get this thing done as it is supposed to. We are ready. I want to assure you that whatever program you have that has to do with malnutrition, with health challenges and what have you, we are ready to commit as much as you can commit so that we can have a better life for our people. So we thank you very much for this.
Thank you. Yes, that's the language. Governor of Niger, the co-convener.
Thank you for that compliment. I was reading this afternoon about an average sales during the Salah period of rams, over $30 million in Nigerian market. And these rams came from Niger, Chad, and neighboring states. You see, agriculture is not just cropping. Aquaculture, that's fishery, animal husbandry. There is need to understand the value chain in animal husbandry. And there is need for an investment, deliberate investment by Prime Minister of Agriculture, Prime Minister of Health, the state government, in collaboration with the FG, to find a way of reducing poverty by providing staple crops, animals, even fingerlings, you know, the whole value chain of agriculture. And you would have the nutrients that's required, because when the man from the Doctors Without Borders was speaking, he spoke about 85,000 for just one set of treatment for someone that is malnourished. 85,000, more than minimum wage. So 85,000 can give you small, what do you call the children of, the babies of goats? Small goats.
Yes.
You can have 3 or 4 from Sokoto, yeah? Kid
Yes,
goats.
kid goats.
So if you make 100,000 naira investment in goats, you have 1 he goat and 3 she goats. In the next 1 year, you also be selling in dollars. Yes. So there is this market. So we need to look beyond what we just think is agriculture. Agriculture is a whole value chain. Thank you.
Thank you. Thank you so much. Thank you. Yes,
Thank you,
Kebbi
Mr.
State.
Convener.
Yes.
Yeah, Kebbi State, like the Athena Centre governor has said, we're always, ever ready to, cooperate with federal government, deployment partners, and give all necessary support. And we're always ready to contribute our own counterpart funding in whatever, the federal government or development partners are bringing to us for the development of our people. Thank you.
Thank you so much. The Ministry of Agriculture, let them be on the. Can we have the microphone, please? Yes.
Thank you very much.
Have 1 minute to respond.
All right, Your Excellency, sir, the former governor. May I have your attention, please? Thank you very much. The federal and the state governments are partners in progress, no doubt about it. When our ministers came on board, they reached out to state governments, and I was there when you came to our place. You reeled out all the good things that you intend to do and you are doing, just like the other governors that are seated to the left of your chair there. Now, agriculture, sir, is on the concurrent list. That means states and federal and even local governments can do that. The Ministry of Agriculture's money spreads to 37 entities, all the state governments and FCT. And working with the state governments, partnering, and having a concentrated effort using the state government's budget is what will take us to the promised land. Yeah? And the federal, local government budget. But all the issues you've raised, sir, I have heard. Some of them are above my pay grade, but I will take them to the Honorable Minister, and I'm sure we're going to have another conversation about this with you and just with everybody else. But really, truly, I mentioned earlier that National Development Plan of the nation says that we're going to leverage resources, 85% of our resources, to make that happen from the private sector. So collectively, the state governments and the federal need to look at that very seriously. We need our private sector, we need that handshake. Yeah? We truly, truly need that handshake. And another thing is, SARS, since I'm privileged to be with you here, the Malabo Declaration says we should put 10% of our budget towards agriculture. We've never been able to do that. The best is 2%, 2 point something percent, and below 1%. Now, we've got to put our money where our mouth is. It's as simple as that. Thank you very much, sir. Your Excellency.
Okay. Quickly,
with due respect.
Before I give the Honorable Minister of Health the last word, two people from the audience will be taking. Just the program manager of the school feeding program, who joined us here. The program manager of the home school feeding program. Yes. Can you take a microphone to her? Just a minute intervention. And then there is Mr. Akim from BNSL, who just sent me a message. They're here producing nutritious micronutrients here in Nigeria. Please, can you just take a minute and, yes. Can you put on her mic?
Good evening, Your Excellencies. I'm so glad to be in your midst this evening. I want to thank you for giving me this opportunity to speak. I remember when I assumed office in September last year, I had my first meeting. I visited Kebbi State. You know, when it comes to malnutrition, you know, it calls for concern, especially us at homegrown school feeding. We have a whole lot to do because we'll be reaching out to about 10 million children. And then what these children take into their bodies, it's very important. So we visited Kebbi State. Thank you, the Deputy Governor of Kebbi State. They received us in Kebbi State, and we went with our partners, the Global Alliance for Improved Nutrition, and we talked about giving our children fortified food. And the governor adopted into it. He accepted, and the following day, he implemented it. Thank you, Kebbi State Governor. Please, I want to ask that Niger State, Katsina, and Zamfara, please, we'll be coming knocking on your door. Please, can you just give us access? We have a whole lot to do with you. Thank you very much. God bless you.
Right next to him there is him. Can he say what? Where is Mr. Akim? Please come to the front. Yes. 1 minute intervention. Yes.
Yeah, thank you, Osita, for the good job you're doing. I'll just say something. Emeka Ugoju Nash Foundation. Why I decided to make my contribution is that our inaugural Nash Health Roundtable, we did it with the local government, Algon, and we are focusing on primary health care. So seeing what is happening today, I think probably our next health roundtable, we will try and focus on malnutrition with the local government. Thank you very much.
Okay, yeah, Mr. Akim, yes.
Good evening, Your Excellencies. I thank Mr. Osita for this invitation. I think what we're doing today is trying to secure the future of our children and the women. So, in view of that, you agree with me, especially the Honorable Minister for Health, that food alone does not affect malnutrition. What nutrients do we get from the food we eat? So, this is where BNSL Limited comes in. We are the pioneer in manufacture of micronutrient powder, which gives the required daily intakes for vitamins and minerals that is used in fortifying the food we eat. So I will appeal to the northern governors, because we've been in collaboration with NGOs before now. They are the one at the forefront of it. But I want more intervention from your excellencies, that we have this package we call Enrich. It's a pack of 30 a single sachet of 1 gram per day on the food. It's sprinkled on the food. And the children will have their required vitamins and minerals. So, in trying to secure the future, today is the future we are talking about. Thank you.
We have UNICEF here, the representative of UNICEF. Charles? Yes.
Yes, thank you very much and good evening. Please allow me to write on the existing protocol. So I'm here to speak on the catalytic funding mechanism that we have in place, known as the Child Nutrition Fund. And that is actually an opportunity where states and the federal government can unlock resources to address the issue of malnutrition in the country. How does it work? For every $1 investment by any state or any or the federal government, UNICEF and its partners will match it by another $1. So what it simply means is that if a state procures 1 carton of RUTF, UNICEF and its partners will complement that with another carton to make it 2. And I think this is a very good opportunity for all of us to unlock resources at the state level to ensure that we address the high burden of malnutrition that we are currently seeing across the country. Thank you very much.
Thank you very much. This is good news. Honorable.
Yes, and maybe just kind of allow me to use this quick opportunity to acknowledge, yes, Katsina State and then Katsina, Zamfara, and some other states for the contributions that they have made. And of course, the leadership of the Coordinating Minister of Health, the efforts that he's leading to unlock $30 million US dollars, which UNICEF and its partners are also working to complement. Thank you very much.
Thank you.
I'll just like to put on record for the Children's Nutrition Fund that the one-to-one match should not be predicated on the funding coming through UNICEF in terms of the 1%. Just to put it on record, because we've raised 30 million, we expect 30 million from CNF to buy products that will be used here in Nigeria, buy locally. So, Osita, I'll just make 4 points in terms of way forward action points. First, on the multiple micronutrient supplements that we've mobilized, these are free, these are donated. They will be here mid-July, and Your Excellencies, Dr. Bagwo, can you stand up? That's our Director of Nutrition. We would like to work with your commissioners through the platform of the Commissioners Forum so that the distribution plan will be in coordination with your facilities. That's one tangible part. The RUTF that we're going to mobilize to also do that, expecting that Your Excellencies, your commissioners will provide you where those sites will be and you can stretch it further. Thirdly, on revitalization of primary health care and BHCPF, we'll write for the outstanding counterpart contributions based on what the federal government has contributed already to Your Excellencies, and we're glad that there is clear willingness to match up because those will be spent locally. Before we started, I showed His Excellency the Governor of Zamfara the impact funds that were available in all the states, most of the states actually, for revitalizing primary health care. But KB, Katsina, and Niger, who are here, are among the few that actually have not had the allocation. I will ask MPHCDA to work with your SPHCDS so that we unlock those resources for the revitalization of primary health care. I think, finally, the compact that we signed with you, Your Excellencies, will operationalize it. I think there's a whole working group working with your officials. We'll build on it so that we co-create the solution together to improve the primary health care system, but also deal with the acute issue of malnutrition. So thank you very much, Your Excellencies, for your leadership.
Thank you so much, Honorable Minister. This has been very, very rewarding and focused conversation. I am very proud of the government officials here present. A few items I would like us to do going forward. One is that this is a multi-sectoral issue, and there is a National Council on Nutrition. Can we have some peace in the audience, please? Audience, please. Thank you. I think that we will want to see the multi-sectoral National Council on Nutrition, and we're going to send the conclusions of what we discussed here to the Office of the Vice President to see the states replicate the combination of agriculture, health, and security to come together in the states to replicate the national, so that there will be multi-sectoral approach, and there will be coordinating bodies both at the state and at local levels to unlock all the funding that is available. Second one is that there is need for a documentation of the coherent plan of what we want to do about this. And we are volunteering. We are continuing with the Minister of Health to see if we can, working with other partners, put together a document that the states and the federal government can say, this is it for this period, and then for the longer term, and we can be, each person can see what they can do from that plan according to their own capabilities. There's also a need for performance-based incentives. Not all governors are willing to respond like this and come up and discuss an issue that involves a vulnerable population. Most times we're thinking of things that involve the voting population, not the vulnerable population. So it is important that we create some incentive for the states that are doing this. The federal government or the funding partners should reward more and put more funding for others to see that there is benefit for performance. And then I think there is also an important part of community involvement. And then finally, the issue of capacity building. We need capacity at the local levels. The primary health cares, the one in my village as almost urban-like as I am from Anambra State, the primary health centers have nothing to write home about. So there is need for capacity building. Sometimes we have fancy buildings, but no human beings. So there is need for that capacity building. And then there is need to engage the civil society more to keep putting these issues on the front burner so that all Aliko Dangote Foundation, Bill Gates Foundation, all of them have some ideas and funding for nutrition programs, but they need to tie it to an existing plan and probably work directly with the ministry and the state governments to achieve that. So on this note, I think that we're going to document this, circulate it to the governors and the minister, and once going by his pledge that we need to move first with the states that are present here today. So we need to see action on these 4 states that are present here today. And I believe that with the way and the time and the investment they've made on this, it will be important for other states to see that there's a first mover advantage. There is an advantage for those who are coming forward. And I believe that our next conversation will be in a smaller roundtable with practical issues to deal with. Who does what? Where is the money going to? Where are the goods going to? Who is taking control? And how are we getting the data back that this number of people have been dealt with, so that Nigeria does not always talk about what is wrong with Nigeria. We will also talk about what we do right in Nigeria. And I believe this is one example of what we do right in Nigeria. So thank you very much, everybody. Master of Ceremony, and I think on this note, we'll come to the end of the program for this evening. If we can have the national anthem before we depart, and pictures in front of here.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland.
Thank you very much, Your Excellencies, ladies and gentlemen. Please may I implore the governors to please just stay on the stage for a minute. We are taking pictures now. May I implore that the governors, while the pictures are being taken, remain on the stage. We do have an award plaque for the governors. Please. We do have an award plaque for the governors that will be presented by the Chancellor of Athena Centre. Ladies and gentlemen, Your Excellencies, it is time for pictures, and yes, okay. Before the governors go, we do have an award plaque for all the governors here present. Please, our dear governors, we would want to do an award, a very quick award presentation from the Chancellor of Athena Centre for Leadership and Policy. Your Excellency, the Governor of Niger State, thank you for coming. Please, dinner is served. Once you go outside, please do help yourself. Dinner is served outside, and it's a buffet. While the pictures are going on, we would like to thank all governors that made our time to attend this event. We would also want to appreciate all the panelists who shared out of the depth of their experiences and expertise. We appreciate you deeply and thank you for making this event worth it. Thank you very much, the Governor of Athena State, for joining us in this event. And thank you also, the Governor of Zamfara State. Thank you very much for joining us in this event.